Good day, ma'am. I'm Dennis Cabiedes and I will be performing the Student Assist Checklist. So for the first procedure is to monitor maternal vital signs. And also the fetal heart tone. So I will be using a stethoscope. So this will be done every hour while in labor. I will also do the pulse maneuver in order to locate the fetal back. So one thing, flex your knees. So, this is to evaluate maternal and fetal condition and tolerance of labor. Next is to place the parturient in the delivery table in a lithotomy position. So, this position was the standard birthing position for better access to both mother and baby. Then, I will now assist the husband to put on cap, mask, and gown, if allowed in the agency. So this allows parents to interact more freely with the infant. Then, coach on proper breathing and bearing techniques. So breathing techniques provides distraction from pain and give her a sense of control. This gives a woman a different focus during contractions, interfering with pain sensory transmissions. Okay, ma'am? So take a deep breath and hold your breath while you bear down with all your might, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then, note the time of baby's delivery. So, the time of birth completes delivery of the infant. Timely documentation helps to ensure patient safety. So, the baby is born 9:05 in the morning. Then, check the blood pressure before giving oxytocin. Then, I will now inject 10 units of oxytocin intramuscular on mother's deltoid or thigh after excluding a second baby. So, this is to stimulate the uterus to contract, thereby helping to prevent hemorrhage. Then I will now regulate IV with oxytocin incorporation with the desired rate. So oxytocin regulation helps maintain firmness of the uterus. Then, monitor mother's vital signs, especially blood pressure after placental delivery. So, monitoring vital signs provide assessment information about hypovolemia. Excessive blood loss causes decreased blood pressure with increased pulse rate and increased respiratory rate as compensatory mechanisms. Then, change mother's gown if wet or soaked with blood. So this is to provide comfort and prevents infection. Now, transport mother to recovery area or to the ward safely. So, monitoring the client status in the recovery area for the first 4 hours of postpartum is the critical period to observe for any signs of postpartum hemorrhage or any postpartum complications. Then, monitor vital signs every 15 minutes during the first 2 hours, every 30 minutes for 1 hour, and every 4 hours until stable. So, monitoring vital signs are important indicators of mother's condition after birth. A rising pulse is an early sign of excessive blood loss because the heart pumps faster to compensate for the reduced blood volume. The blood pressure falls as the blood volume diminishes, late signs of hypovolemia. So, I will be taking your vital signs. Then assess the firmness, height, and positioning of the uterine fundus with each vital sign assessment. So assessment provides information about the uterine tone, height, and position. The most common reason of excessive bleeding is that the uterus does not firmly contract and compress open vessels at the placenta site. If the fundus is firm, no massage is needed. So I will be assessing your uterine fundus, so can you flex your knees? And I will be exposing your abdomen. And lastly is to record all assessment done and vital signs on the patient's chart. And also I will notify primary caregiver for any deviation from normal findings. So proper documentation provides information of the status of the client after delivery. Notifying the primary caregiver for any abnormal findings will require other interventions if other measures are ineffective, like stopping hemorrhage. So here I will write all the assessments done, as well as the vital signs, which includes the temperature, blood pressure, respiratory rate, heart rate, and everything that was done. I will also record the medications which I injected 10 units of oxytocin intramuscularly on left thigh at 9:30 a.m. and I will put sign, as well as I have regulated IV with oxytocin at 9:38 a.m. and also sign. And I will include all the significant findings on my assessments. So that's all. Thank you so much.